A lot of my patients will ask, what are bioidentical hormones? The answer is real simple. Bioidentical hormones are hormones that we give people, men and women, that is the exact molecular structure that you make in your body throughout your lifetime. There's a number of hormones out there for women, Premarin and Prempro, for example. They're made from horse urine, actually pregnant mare horse urine. They're not bioidentical. It's a completely different molecular structure than what a woman makes in her lifetime. A woman makes estradiol. The bioidentical hormone is an exact molecular structure that the woman makes in her lifetime. Testosterone is the same way for men. It's the exact molecular structure that men make in their lifetime. The reason this is so important is because you don't get the side effects that you get with the other synthetic hormones that are not the same molecular structure. So when we give a bioidentical hormone, it's like taking the hormone or actually producing it like you did back when you were younger. It's going to do what the hormone actually does. It's not going to cause side effects. It's not going to cause problems that you may get with the synthetic hormones. When you take bioidentical hormones, it's basically like your body's producing it on its own. You're not going to have side effects when your body's producing it. You're not going to have side effects when you take a bioidentical hormone. And so in that respect, it's going to be safe, it's going to be effective, and you're going to get everything you need out of that hormone. It's going to give you energy. It's going to give you your libido back. It's going to give you so many things. And when you look at it from a molecular perspective, you're getting the identical hormone you normally get.